we're just getting updated information. And we're doing a M&M count to see how many remain. Well, we had a constructive conversation to talk about the concerns the speaker and the majority leader have of the implementation of this, particularly the caps, and especially the 5 counties where the make sure they have an option if the caps are reached. Commissioner Rothman explained that he's been dealing with the insurer, and we're working on to ensure that every Minnesotan who needs coverage will get coverage over the course of the next 3 months, and it's a work in process, but we're working very closely with the insurance companies, and I'm optimistic that everybody who seeks coverage will get coverage. Blue Plus does not have a cap, so there are 82 counties where people are assured that they'll be able to obtain coverage. We talked about the urgency of getting something resolved for the premiums rebates for people who are not qualified for the federal tax credits. We are going to have our staffs and the other caucus staffs work over the next week, recognizing the reality of an election in a week from now. But we're going to draft legislation. We'll work on that and be ready, I hope and believe, to go forward with a special session as necessary very shortly after the election. Give people by then, if not before, who are buying and don't qualify for the federal tax credit, give them the assurance as rapidly as possible that what they can expect to receive by the time their bills become due on January 1st. MNsure so far is reporting over 13,000. That's the most recent number. 13,000 applications have been opened. Contrary to what has been said, that the system has not been down. There's been a somebody's trying to jam the call center and making robocalls to try to snafu the thing, which is deplorable. But they're identified that culprit and are acting minute to exclude them from the system. But we're doing our best to make it work as well as possible, and unfortunately there's some people out there who want it to work as badly as possible, and we're having to contend with that. But again, so far the system's been operating, the call center as well as the MNsure online. It's not going to be perfect, and we've sent out to every legislator contact person in MNsure to deal with any individual problems and glitches. And all the legislators have my residence number, and I urge them to call me if there's a hang-up, because we want to make this work as well as possible for the people of Minnesota. Mr. Speaker?
Yeah. Thank you, Governor. We did have a productive meeting. I think we share with the governor a desire to minimize any discomfort by all of this felt by Minnesotans. There is a large degree of uneasiness and anxiety. Sure. It's good they sped by. They weren't looking for us. You're welcome. There is a large, high level of anxiety out there amongst folks, whether that's a perception or a reality. I think is yet to be determined, but folks are a little uneasy about all of this, and I think everything that we can do to provide some stability and comfort to them during this is what we have to do. I think we have no choice but to help Minnesotans out through this and provide them with some sort of relief. We obviously need to go through the normal legislative process and figure out what that looks like, but we've made a commitment to the governor that we stand with him, ready to help Minnesotans that are being hurt by this. So I did, and this meeting was originally set up to talk about the caps, and I do the commissioner did assure me that folks will be able to access coverage. I shared with him that I don't have complete faith that that everyone in those 5 counties is going to have coverage, and I believe that absolutely must be a top priority, making sure that every Minnesotan who wants health insurance has the ability to purchase a health insurance policy. And right now there are 5 counties, and I think the number is almost 8,000 people that have lost their previous provider that will be seeking to get coverage within those caps. So we're going to monitor that. I think the commissioner will keep in touch with us as to assure us that those folks are being helped and that they will have coverage. And anything that we do, if for some reason they aren't able to fit into the caps, we need to find an option for them. And I did express to the governor that needs to be a priority of anything that we do to provide relief to Minnesotans, is making sure that every Minnesotan has the option to buy some sort of health coverage, even if it's not exactly what they want. I think it's a basic necessity that we need to make sure people have the option to buy something. And after all, they will be fined if they don't have coverage. So that's pretty important. The governor said we're going to have our staff and members continue to work on this throughout the week. We will need to have a legislative hearing on this. I haven't talked to Senator Bach about when that would take place. I think with the election happening, it probably, you all might really appreciate if that happens before the election, but I think for the good of the folks that we're trying to help, it probably is better if we do it right after the election, and hopefully we can narrow in on what exactly relief means and how we'll provide that to Minnesotans. So with that, I think we can take questions if you have. I don't know if you want to add anything.
Yeah, I'll just add. Obviously our caucus is really concerned about all the folks that are trying to get in health insurance that haven't been served, and so we acknowledge that we need to work together to make sure that happens. And I would just say I was very encouraged to hear that Commissioner Rothman sent a letter asking for an enrollment deadline. I think that's a good first step. And additionally, Speaker Daudt talked about some of the concerns with the 5 counties and folks not being able to, potentially not being able to get insurance because of the enrollment caps. And I was encouraged that the governor and commissioner were willing to work with us on a letter requesting that the feds would be willing to waive the penalty if for some reason those folks aren't able to get the insurance coverage they need. So that was encouraging to me. It's a good first step. We need to make sure that we're joined on that, and that we do everything we can to get the federal government to make sure that we can take care of those folks in those 5 counties and throughout Minnesota.
Questions?
Mr. Speaker, even with assurances by the administration that folks will end up getting enrolled, you said you don't have much faith that'll happen.
Well, the reality is that they've announced that there's 112,000 people that are losing their current provider because they're pulling out of the individual marketplace. There are caps in place of 25,000 slots available with the other providers. That's with the exception of the HMO type narrow coverage that is available to 82 of the 87 counties, but there are 5 counties that will not have that. So once those 25,000 caps are full, there is a very distinct possibility that some of those 8,000 people, or 7,000, what is it? I'll give you the exact number. 7,891 people in those 5 counties that are losing their health insurance provider may not have an option. So I think that was the reason for this meeting today, and it was and remains my biggest concern through this process, that we make sure that all of those Minnesotans have an option to buy some sort of health coverage. And the commissioner has assured me that he will work with the plans to make that happen, but we're going to monitor that closely.
So, which is it though? I mean, if the administration is
Commissioner Rothman just to respond to tell you what he's doing.
Yeah,
right?
I mean,
You can follow up.
So, we have the expectation that and assurance, and I believe we will have no issue with making sure that everybody who has or wants to have coverage, whether renewal or new people, in those 5 counties will get coverage. The caps are set high enough. We've got commitments with the insurance companies to make sure that if there are any issues with that, people who want to re-enroll or enroll new will have an opportunity to get coverage in those 5 counties.
What 5 counties?
We're talking about 5 counties that are in central Minnesota. So it's Crow Wing, Mille Lacs, Morrison, Stearns, and Benton.
So, I mean, which is it though? For consumers who are waiting to hear answers about, their coverage for next year, the administration says they are confident and have commitments from insurers that everybody will be covered, but Speaker, you have doubts that that'll happen. I mean, what sort of clarity can you provide to people?
Well, we've been told that there are caps, and so I guess we just need to make sure that Commerce is working with the insurance companies to make sure that there's going to be coverage for these folks. And if for some reason there is not, I think we as the legislature and the governor will have to step in and do something to give them some option so that they can provide health insurance for their family. So that's my main concern. I'm not sure anybody knows exactly how this whole thing is going to unfold, but we'll watch it very closely. I want to make sure that all of those folks have an ability to buy some health insurance. And that they can fit in under the caps, or that the insurance companies either flex their caps or do something to provide coverage to these folks. And if they don't, then we need to step in and take some sort of action. I'm not sure what that looks like yet, to make sure that these folks have an insurance option. I think that's just a basic thing that we need to do.
I absolutely second that all the way.
Yeah.
And I would say some of the concern too is we have commitments, as the commissioner said, but we don't have commitments in writing for whatever reason, and that does cause me a little doubt. So I want to make sure that we're moving on that and making sure that they're committed to that coverage, and that's why potentially getting a federal waiver is a good part of the solution as well.
Mr. Speaker, what are your thoughts on the report that someone's trying to disrupt MNsure's operations this morning?
The first I've heard of it was right now when the governor mentioned it to you, so I don't know anything about that. I sure hope that's not the case. I've spent a week and a half now out talking to Minnesotans, and of course I've been doing a little campaigning as well, but I have been having kind of listening sessions, and we've invited folks in different cities who are affected by this, just simply because I wanted to hear their stories, and I wanted to hear how is this really impacting Minnesotans in their lives. And it's just heart-wrenching, these stories, and so I think we need to do everything we can to make sure that we're providing some level of comfort and certainty to these folks that number one, we're gonna help them in the short term, but also long term we're gonna fix this so we don't get in this situation again. And it's an incredibly complex situation, probably both short term and long term. But folks have our commitment that we're going to do everything we can, both short term and long term, to provide that comfort and stability in the marketplace that hopefully and this just frankly isn't a time to be blaming folks or talking about that sort of thing, and it's not about that at all. This is really a big deal, and folks have a high level of anxiety about this. And I've been getting emails this morning from folks who, and that's been ongoing for the last few weeks. Folks just have a high level of anxiety and concern, and rightfully so. So we just need to do everything we can to help them and try to navigate our way out of here.
Governor, on the robocalls, have they figured out who it is, and do you believe this is a political?
I don't know the source of it. I just learned of it as did the speaker just before we walked out here. I'm told that Commissioner Dayton they've excluded this whatever the source is from, and whether somebody else will attempt the same or whatever, I don't know. But we'll deal with it as it develops.
And has that kicked people out who are trying to get insurance?
It's delayed the call time. The call time was 7 minutes at about 9 o'clock, and now it's up to 19 minutes because of this robo. But it's going to shrink. It's shrinking now already. The average wait time now that they've separated this whoever it is from the ability to access to. So it's deplorable that somebody or anybody is trying to disrupt this. As we said, over 13,000 people have already opened accounts with MNsure, and we're doing everything possible. The call center is staffed with 160 people, and the calls, as I say, are being responded to except for this disruption. And the system is not, contrary to rumors, has been operating throughout the MNsure system and the call center. And given the onslaught of people, understandably, who are wanting to apply the very first day, over 13,000 people in less than 3 hours, but it's ongoing, and we'll have to we're monitoring by by the minute, and we will continue to monitor it by the minute until it's all worked through.
Commissioner Rothman, we're talking about the the enrollment camps and what you're trying to do to work it. Is your advice to people still to try and sign up as quickly as possible to meet the enrollment camps?
Yes, they should. Yeah, they should sign up as soon as they can try to, either directly, most importantly through MNsure. They have to try to apply for the tax credits. It's very important for them to do that first, and then do everything they can to do it. And we'll monitor the situation very closely.
Yeah, I would second that. People in Minnesota, we're got varying numbers, but there are a significant number of Minnesotans who qualify for the federal tax credits and are not availing themselves of those, even though the program's been going now for 4 years, so 3 years, I guess. So it's just really, really important for everybody's sake, especially with the premium increases, to go to MNsure and see if they are eligible. The income level is 400% of the poverty level set by the federal law. That's $47,500 for an individual, about $97,000 for a family of 4. Anybody who fits within that category who's buying through individual coverage doesn't need to pay what the sticker price is because of those credits. And similarly, if we can get this through, and I'm optimistic we will right after the election, get something along the lines of what I proposed, a rebate to people who are not eligible for those federal credits. That would bring the average rate increase from 55% down to 16%, which is still high, but it's a big change, which is why it's imperative that the 4 caucus staffs and mine work together during this next week, so we got something ready to go immediately after the election.
How close do you think you are on finding some sort of agreement on something relief that could happen in a special session after the election?
Well, we're committed. We've committed to work together, our staffs, and we're going to draft legislation. That was a request. We'll do that very quickly. I've talked to the other 3 caucus leaders. We haven't gotten into the details, but we'll urge that the 4 caucus staffs and our people work together over the next week and have something ideally ready in print in statute form and ready to go and right after the election. And we'll see at that point with the 4 caucus leaders, so where we stand and how we can go from there. But everybody understands the time urgency to relieve this uncertainty for people who are now would not qualify for the federal tax credits.
The 13,000, are they people who just got through on the phone, or are they people who actually bought policies?
Well, the people in process, they're people who have, what's the right terminology? What's the right, Warren, what's the right term?
There's about
13,000 of open applications are in
Yes.
process.
Yes,
And how many have been completed so far?
I'm sorry.
How many have been completed so far?
So far, we have 2,100.
So at that rate, could you be hitting the caps within a couple of days?
Yeah. Well, we'll see. Our goal, or what we're planning to do, is monitor the caps twice a week, make sure that we're communicating, getting the information from MNsure, from the insurance companies, and we'll keep a close eye on it.
But just twice a week?
Reporting in twice a week, we're going to calculate them and make sure that, as we in real time, what we see happening, and keep track of them.
Commissioner, some of the insurance companies have been concerned that there'll be too long of a delay between when they reach the caps and when they're removed from MNsure, and that they'll end up taking thousands of people above their caps instead of the unavoidable sum amount. Do you have any, is Commerce working on that to try to minimize that, prevent that from happening, or what's Commerce doing?
Yes, we are working on it to minimize it, and that's why we have the reporting period, working with the companies, and then to make sure, and most importantly from the consumer's perspective, that if you enroll and apply, you will get coverage.
As a speaker, can you weigh in on the rebate question? Do you agree in principle to a rebate and just need to work out the finer details in legislation, or are you?
We agree that folks are going to need some help, and we're going to agree to be part of the solution. What exactly that looks like, I obviously have an entire caucus and an entire body of legislators that will want to have input on that, and I think there is a common reality or realization that folks in the legislature understand that we're going to need to help some folks. This is really a crisis for the Minnesotans that are going through it, and we're going to need to do something. So, you know, I wouldn't say that we're objected to the governor's plan at all. I think maybe we'd tweak it a little bit, but that's not even for me to say. I think our members who kind of specialize in this area would have to weigh in on that, and will and are weighing in on that. So I think the administration is going to draft up the language. I've agreed to provide them with some feedback in the next couple of days from our members, and then we'll likely have a public hearing on it, and hopefully that would be a joint hearing. And like I said, I haven't talked to Senator Bach about that, but my hope is it would be a joint hearing between the House and the Senate health committees or the oversight committee, and let folks weigh in on that solution. So,
Governor, has your administration requested an extension on the open enrollment deadline yet?
Yes, Commissioner Rothman submitted that request for an extension last Friday after excellent suggestion by Representative Davids, and I really appreciate his making a very constructive proposal. It's a very good idea, and so we're pursuing that.
Anything else on this topic?
Okay, very good. Thank you.
Thank you.
Yeah, thank you, Governor.
Any questions, anything else?
Thank you.
Mayor, thank you.
Anything else on anything else?
Thank you.
That was great. We had I don't know what the count was, but
You had some left.
we saved some. Well, I didn't give any this year. I didn't give any to the adults. The kids got it, and anybody who had a Chicago Bears jersey was not allowed in the gate. So, but yeah, it went very well. It's just one of my very favorite events of the year.
I think maybe you should have let the Bears players in, and they wouldn't have been on the field.
Well, the actual player, yes. Well, enough said on that subject.
Governor, has your administration signed off on plans to send Hennepin County Sheriff's deputies or anyone else in the state over to the North Dakota pipeline protest?
Well, the authorization was signed by Mr. Kelly, and they proceeded accordingly, and they're all back now. So it's resolved.
All back?
I'm told.
Or did you pull
No, I did not pull them back. I'm told. No, I didn't pull anybody back, and I'm told that they were all returning yesterday. So that's my understanding.
Do you object to Minnesota law enforcement officers going over to that?
They went and they served that purpose, and I, commend them putting themselves and their lives and their well-being on the line. I commend them for doing so. It sounds like they conducted themselves very professionally, and we're fortunate to have law enforcement people that are highly capable of stepping into a situation.
Will you object to more officers going over there?
I did not object. We have a compact signed by all the 50 governors applies, and somebody can make requests under that compact, and that's the mutual obligation we've agreed to.
You have talked to Governor Dalrymple?
I've not talked to Governor Dalrymple, no.
Any other
Okay.
topics?
All right, thank you.
Thank you, Governor.
That was a long time to hold up.
Pretty hard being a video photographer, isn't it?
Yes. Now I know how much candy recording the whole thing.
Why?
I lied.